Hey, it's Michelle Nesky, the Posh PA, and today I'm going to answer the question, what if a patient doesn't want to see a PA? What if a patient refuses to see a physician assistant? Can it happen? Of course it can. It can happen in any medical profession. But as a PA, you need to be ready to answer this question. And it could sometimes be a PA school interview question, so make sure you listen up. Now, if you haven't already, smash the subscribe button. I'm here every week giving you new tips on how to get into PA school, become a successful student, and a fulfilled practicing PA. Now, has it happened to me that a patient says, if you're not the physician, I do not want to see you? And I'm not going to sit here and tell you that hasn't happened to me, because it certainly has. Does it happen that often? No, it doesn't. But it does happen, and when it does, you should be ready to respond in a professional manner. Now, before I even get into answering this, I want to say that your administrative staff and who's ever scheduling patients should always notify the patient who they are being scheduled with and what type of provider they are being scheduled with, so that there aren't any surprises for the patient. So the patient knows they're coming to see a PA or an NP or a physician. Okay, so that should be done up front, which really minimizes this happening. In addition, it's also great for offices and clinics to have their PAs on their website so that patients can search up their background and how long they've been there and a little bit about their provider as they would a physician as they're coming into the office. So there are a lot of things that can be done up front to mitigate this issue going forward. Now, does this happen to me on a frequent basis? Definitely not. But the patient has rights. Patients can choose who they want to see as their provider, and we are going to respect that, right? So it's really important that you know how to address the concerns of a patient when they don't want to see a PA or when they do want to see a PA, right? So some people and some patients maybe had not such a great experience with a PA in the past. And unlike physicians, when a patient goes to see a physician and they don't have a good experience, they just go to see a different physician. However, when it comes to PAs or even NPs sometimes, when patients have a bad experience or what they felt was not the best experience with a PA, then they typically don't want to see PAs again. And is that always fair? No. But you have to remember that patients do want to have control of their care and of their provider. Does that mean a patient who had a negative experience with a PA before will never see a PA again? No. I've had a lot of patients who have seen other PAs in the past and have seen me, even if they've had not such a great experience before. So there are definitely ways to overcome this, and you need to be prepared for this going into your PA school interview, but also going into the profession as a whole. So when I am told, when a patient gets roomed, if I am told by the nurse or the medical assistant who has already assessed and triaged the patient, if they mention to me that this patient is not too keen on seeing a PA, I don't automatically not go in the room, okay? So if they say this patient refuses to see a PA, then of course I'm gonna honor and respect that. If a patient is just like, I'm not sure about it, or for some reason has expressed their concern to a nurse, I still give that patient the benefit of the doubt and really want to get them taken care of quickly. I don't want them waiting around too long. I want to get their problems addressed, and I want to get them feeling better as soon as possible, right? So very oftentimes I use this as an educational opportunity for patients who may not fully understand the role of a PA and what we are capable of doing. So I work in the oncology setting, where it is not unusual for patients to see a physician regularly, but obviously within the care team and the abundance of patients, they're going to be seeing other providers like PAs and NPs, other advanced practitioners. So it's important to use these opportunities to educate our patients on how we can help them, okay? So if I am told that a patient is not sure about seeing a PA, they still want to see the doctor, that's totally fine. Normally, when I walk in the room, I introduce myself. I say, hi, I'm Michelle. I'm the PA that works in collaboration with Dr. So-and-so. I understand you're here for this today. why don't we talk a little bit about it? And if the patient is immediately like, no, I'll save my questions, I've had a negative experience, however they respond, I will say, I completely understand, and I'm happy to have you wait for the physician, but it may be a little bit of time. So let me just gain some information from you so that we can really get started on addressing your problem quickly and see what I can do to intervene in the meantime. And if they say okay, then obviously we get going. If they say no, I'm not comfortable seeing a PA, sometimes I will ask them, oh, was it an experience you had before? Sometimes they'll say yes, sometimes they'll say no, but I use this as an opportunity to tell them, that I'm a PA, that I've been a PA for a long time. And if you haven't been a PA for a long time, that's okay too. And that PAs are nationally certified, licensed medical practitioners that work in collaboration with physicians, and that we can diagnose and treat and order tests and interpret results and even perform small procedures and assist in surgery. And so that we're really well trained to be able to take care of them in collaboration with our physician and independently. So I think it's important to really take that opportunity to explain to a patient what a PA is and does and how we can really help them get their problem addressed as soon as possible. I will tell you that in reality, once I get talking to a patient and once I start talking to them about their symptoms and really focusing on them and what their issues are, how long they've been happening, how severe they've been, what has helped them, what has not helped them, really getting to that root cause of why they're there and redirect them back to why they came in the first place. Once we start having those conversations and I start maybe giving some ideas about what might be going on or how we might be able to address those problems, very frequently we get into a conversation and we really have a nice experience and a nice exchange that the patient doesn't feel strongly about seeing the physician anymore. It happens all the time, right? It's just sometimes that comfort level, that awareness that you have to project to them to really understand why they're having these feelings and how you could potentially overcome them as a PA to show them that you are a competent and trained medical provider that is truly here to help them with their root medical problem in a timely and efficient manner. And as always, if they request to see the physician and the physician is present, I am always going to allow them to do that. That is their right. Now, if a patient outright refuses to see a PA, which does not happen all that often, then obviously we want to respect that. Sometimes I'll pop my head in the room and say, hey, I'm Michelle, I'm the PA. I know you might not be interested in speaking with me today, but it's going to be a little time to see the physician. Do you want to get started with me or do you want to wait? I give them that option, right? Because then it opens the door for me to help them in their education. If they say no, the answer is no, and I tend to respect that, okay? So there are ways to handle this situation in a professional and calm way. Am I offended when somebody doesn't want to see a PA? No, I'm not offended. It is their choice. But if I am given the opportunity, I am going to show them that this experience with the PA is going to be an amazing one by paying attention to detail, by telling them what I can do for them, by showing them my knowledge and my diagnosis capability, by offering them different treatment options for different issues that they may be having, by sitting with them and really listening to them and talking to them at their level so they can understand what is going on and why we are going to treat it that way. And a lot of times, once I start doing that, it's converted, right? And they're seeing a PA and it's great. And in the future, everything is copacetic, okay? So you have an opportunity to really show patients who might be a little bit concerned, nervous, unaware about seeing a PA, what we can do for them and what this experience can be like for them so that they want to see you again in the future and they know the type of top quality care that you're going to deliver to them. And obviously you're going to collaborate with your physician and offer them the opportunity to see the patient as well if they are present and if they are there. And again, if a patient refuses, then they have that right, okay? The patients have rights just like everyone else, and they can choose which provider they want to see. With that being said, I believe that you can show your value in your interaction with a patient, even if they are a little bit nervous about seeing you in the first place. Use this as an educational opportunity. Be able to explain very clearly what you are able to do for them and how you are able to help them in a calm and pleasant demeanor. The last thing you want to do is be combative with a patient who may have had not such a great experience with a PA before. We want patients to love PAs, right? Just as they love their physicians. And they really should see us as a team. And so it's really important for you to not be offended, to remain calm and know your value and know your worth and know what you can offer to a patient. You're well trained, you have lots of experience, and you can really educate them on what it means to have a PA as your provider, right? So I see this as an opportunity for success for our profession and to advocate forward. Again, is this happening to me on a daily or weekly basis? No. But when it does happen, sometimes, especially as a new graduate, it can definitely put you on your heels for a second. If you are getting this as a PA school interview question, or you're in a scenario where a patient is literally refusing to see you in an MMI type situation, you definitely want to remain calm and just say, oh, can you tell me a little bit more about your past experience? And I can explain to you, sort of how I can help you, and really kind of work through why that is. And really kind of educate the patient on what you can do. You can't go wrong there. And at the end of the day, if they still say no, obviously you're gonna allow them to see the physician, right? So anyway, it's something you need to be prepared for. It's not all that common, but just know that this is your opportunity to not only tell yourself and tell your friends and family what you do as a PA, but it's your opportunity to show professionally what you can do for patients by saying you're a nationally certified licensed medical practitioner that works in collaboration with physicians to diagnose, treat, prescribe medications, perform minor procedures, et cetera, depending on your state and depending on your scope of practice. So I really hope that this gives you a full understanding of what it means when a patient doesn't want to see a PA and what you can do in those instances to overcome it.